In a world already full of crises, one question is starting to disturb the global conscience. Say, what happens if two powerful nations on the edge of conflict consider the unthinkable? Israel and Iran, both heavily armed, both deeply divided, and today, dangerously close to war. But this video isn't about politics or military strategies. This is about something far more personal: your health, your safety, and your survival. Welcome to Global Health Guide. If this is your first time here, we bring you urgent, research-based insights into global healthcare, survival planning, and medical realities. So, please subscribe to our channel to stay informed, because in a world like ours, knowledge is more than power, it's protection. Let's talk about what almost no one else is talking about. If a nuclear war breaks out between Israel and Iran, what would be the actual health consequences for people living in these countries, and also for those living in surrounding regions? We'll take you beyond the breaking news headlines and into the terrifying long-term effects that war could unleash on your body, your mind, and your future. Because if such a war happens, it wouldn't only impact Israel and Iran. The entire Middle East would feel the effects, and so would parts of Europe, Asia, and even regions hundreds of kilometers away. From Iraq, Syria, Lebanon, and Jordan, to Turkey, Egypt, and the Gulf states. This war could send radiation, illness, and trauma across borders faster than missiles. But first, let's understand what happens during a nuclear explosion. In the first few seconds after a nuclear blast, temperatures around the impact zone rise above 1,000,000 degrees Celsius. Human bodies at the center are instantly vaporized. Buildings collapse. Fires erupt and sweep through entire neighborhoods. And those even several kilometers away suffer third-degree burns and permanent damage. But perhaps the greatest threat begins after the explosion. Radiation, a silent, invisible, and deadly. In the hours and days following the blast, the survivors, if any, face a terrifying new danger: acute radiation syndrome, also known as radiation sickness. It starts quickly, within hours. Victims may suffer vomiting, severe diarrhea, confusion, skin burns, and internal bleeding. Some may experience total bone marrow failure and die within days. But even those who seem okay initially might face long-term health breakdowns. Unlike war wounds, radiation doesn't stay local. It travels in dust, in smoke, in water, and even through the air. Now let's look at the countries most at risk. Geographically, many nations sit too close to comfort. Lebanon and Jordan are both within just a few hundred kilometers of potential strike zones. Syria and Iraq are already suffering from fragile healthcare systems, are likely to experience direct and secondary radiation exposure. Turkey and Egypt, depending on wind patterns, could also be exposed to radioactive particles. Even countries like Kuwait, Bahrain, and the UAE are in serious danger. Radiation clouds can float and spread to Greece, Cyprus, and even parts of southern Italy, carried by high-altitude winds. And what happens next is perhaps even more frightening. If we study the aftermath of Hiroshima and Nagasaki, which involved just 2 bombs, we see the tragic long-term effects that still haunt those cities today. Survivors experienced a tenfold increase in leukemia, along with skyrocketing rates of breast, thyroid, and lung cancers. There were fertility issues. Children born decades later had genetic mutations. The eyes, skin, immune system, everything suffers in the shadow of radiation. And beyond the physical body, there's another devastating cost, one that's rarely talked about: the mental health crisis. Even people who aren't physically near the explosion will suffer emotionally. Chronic anxiety, panic attacks, PTSD, and depression will likely rise across the Middle East and even beyond. Children will suffer nightmares, fear of the sky, and trauma that could last for the rest of their lives. Refugees will face unbearable stress, fear, and uncertainty. Entire communities will live in fear of what's next. And this kind of fear becomes a disease in itself. And that's why we're talking about it, and not to create panic, but to prepare, to educate, and to help people protect themselves and their families. This is not fear-mongering. It's an act of protection. This is only the beginning of our exploration. In the next part, we will dive deeper into how nuclear war could break down entire healthcare systems in minute as a broken bar, how nearby regions including parts of Europe and Asia can prepare for the fallout of broken bar, and what international health organizations like the WHO and Red Cross recommend for survival in such a worst-case scenario. Israel and Iran. The first system to collapse may not be the military, economy, or transportation, it will be the healthcare system. Hospitals near the blast zone will be obliterated in seconds. Emergency medical teams will be killed, injured, or overwhelmed beyond help. And even in cities far from the detonation, the system will buckle under the sudden wave of radiation cases, burn victims, trauma patients, and psychological emergencies. In the blink of an eye, modern healthcare will become ancient again. Let's imagine this crisis more clearly. Picture a child in Baghdad, coughing blood due to radioactive dust carried by wind. Picture an elderly man in Tel Aviv, who can't get dialysis because the hospital is running without power. Picture a pregnant woman in Oman, terrified to give birth, unsure if radiation will affect her baby. These are not far-fetched sci-fi scenarios. They are likely realities in the first 48 hours following a nuclear exchange. And worst of all, this won't be a one-time disaster. This will be the beginning of a generational public health catastrophe. Beyond the immediate destruction, there's a silent killer that creeps in next. The collapse of medical supply chains. The Middle East depends heavily on Europe, Asia, and the United States for critical supply, so everything from antibiotics and chemotherapy to insulin and anti-radiation pills. A war would shut down ports. Airports would close. Roads would become war zones. Planes won't fly into radioactive zones, and ships won't sail near them. The result: essential medications would vanish from pharmacies within weeks. Even people far from the war, diabetics, cancer patients, transplant survivors could die simply because the medicine they need no longer arrives. The next health crisis comes with the movement of people. As radiation zones expand, millions will flee their homes. These are not tourists, so they are desperate, terrified refugees. Countries like Iraq, Turkey, and Jordan will suddenly receive hundreds of thousands, if not millions, of people needing shelter, water, food, and most importantly medical care. But refugee camps are breeding grounds for disease. With poor sanitation and overcrowding, illnesses like cholera, tuberculosis, hepatitis, and even measles could erupt overnight. With every new border crossed, the threat of epidemics increases. And radiation doesn't care about borders. Wind currents can carry radioactive particles hundreds or even thousands of kilometers. Nations like Greece, Cyprus, Malta, and even southern Italy could face nuclear fallout in the form of radioactive rain. In the east, countries like Pakistan and Afghanistan, who are already dealing with economic strain, may see radiation levels spike without warning. Panic could spread faster than the particles themselves. People would hoard food, water, and medicine. Trust in governments and systems would collapse. And in this panic, more people could die from fear and misinformation than the actual radiation. What can be done? The World Health Organization, WHO, and other global health agencies have outlined clear steps that countries and communities can take to reduce damage. First, governments near high-risk zones should distribute potassium iodide pills to protect thyroid glands from radioactive iodine. These pills are cheap and effective, but must be taken before exposure. Next, hospitals and clinics should begin training staff in radiation response, see how to triage victims, decontaminate patients, and manage large numbers of burn and cancer cases. Every home near a strike zone should have basic supplies like bottled water, N95 masks, sealed food, and emergency first aid kits. Underground spaces, parking lots, basements, subways should be designated as radiation shelters. Even a few feet of concrete can significantly reduce radiation exposure. Most importantly, People must be educated. We can't wait until the missiles fly to start preparing. People must know how to seal their windows, avoid contaminated water, stay indoors, and recognize early symptoms of radiation poisoning. A prepared population will survive better and help others survive too. Information is not fear. Information is safety. Beyond physical damage, the long-term mental health effects of nuclear conflict will be devastating. Survivors, especially children, will carry invisible wounds, trauma, anxiety, nightmares, and PTSD. Families will mourn not only loved ones but also the futures they lost. The fear of airstrikes, sirens, contaminated food, and an invisible death in the air will scar generations. Even in countries untouched by the blasts, people watching from afar through news, social media, and first-hand stories will experience second-rate trauma. Mental health will become a silent battlefield of its own. And yet a broken bar, there is still time, still hope, because by discussing this now, by imagining the worst, we can prepare to prevent it. The goal of this video isn't to scare, but to save. War may be political, but health is universal. No child deserves to be born into radiation. No parent should have to choose between food and medicine. No nurse should die simply for doing their job. We must demand that leaders recognize the health costs of war, not just the political ones. We must strengthen emergency systems, build regional healthcare coalitions, and educate every citizen in harm's way. If the worst does happen, the ones who are informed will be the ones who survive. And perhaps those who survive can help rebuild a safer world. This concludes part 2 of our urgent documentary on the health consequences of a potential nuclear war between Israel and Iran. We hope this video opens your eyes, moves your heart, and prepares your mind. Please share this with your friends, family, and especially those in at-risk countries. It may be the most important video they watch this year. And don't forget to subscribe to Global Health Guide. We bring you critical, research-based updates on global health risks and how to survive them. Stay safe, stay informed, and let's protect each other, and no matter where we live.